we can begin now. Obviously, because it's a community program aimed and directed at the Bame community across the UK, not just the Harrow borough, but across the UK. We see that the hard to reach communities like ours, according to the government, is that they try and reach us in order for us to help ourselves. So this evening, we are going to go straight into this discussion. We want to see why the Bame community have been impacted hardest and what we can do, how we can help ourselves. So on the platform this evening, I've got two professional gentlemen who are going to be talking to us this evening. So this is what the program will look like. So we are nearly 7 minutes behind, so bear with us. We are going to introduce Mr. Joshua Kende, who is on the line now. I mean, we can see him. It's my colleague, and he's a clergy and also a social work team manager in Wolverhampton. And I saw Dr. Aino briefly. I'm not sure if I've lost him. Okay, so we'll wait for Dr. Aino when he returns. He's here? Yes. Okay. Dr. Aino, can you reveal yourself? Can we see you? He's there. Oh, okay, there he is. Okay, yeah, there you are. Okay. So can we put the two of them? Okay. Side by side, thank you. That's fine. Okay, so thank you both for joining. We appreciate you. Thank you. So Dr. Aino, I've lost him again. Here he is. Okay, that's fine. It's a pediatrician with one of the NHS trust hospitals in Harrow, and also is a wonderful friend of ours and a member of our local community church. So both of them will be talking us through what we need to do for ourselves in order that we may protect ourselves, protect our families, and also protect the people in our immediate environment. So these are the people. I will just be here as an anchor person. So if anyone have any questions, please, let's ask them. So I'm going to run through what the issue is at the moment. So we want to break the chain of infection amongst the Bame community. And obviously we know that the recent reports by the government on race and race relations in England have recommended that the word Bame should be dropped, that each community should stand alone. So, but for the purpose of this discussion, we will keep Bame because it's a community-wide program. So the current slogan is hand, face, space, and fresh air. Hand, face, space, and fresh air. So what's the situation? Discussion from our last meeting, we said that over just under 4,000 people, 4,000 deaths from the Black and minority ethnic group up until 9th of June 2020. We don't know what the current figure is, and that made up 15.5% of the total death in the UK. That's quite high, knowing that the percentage of us totally in the UK is quite small. Okay, so some of the highest deaths and hospitalization rate during the outbreak have been in London, where 40% of the population are from ethnic minority background. So we accounted for 11% of the hospitalization. So we want to reduce that. The reason why we are here is to reduce that. And the reason that was given by NHS England was that because those of us from the Bame community, we do people-facing jobs. That is the place where the infection rates are high. We live in mixed household of all age group, mixed generational groups. We are likely to live in urban areas. And then as a result of that, we are exposed more to the COVID virus. So also for those of us who work in this environment, in order to protect ourselves, we need to take more precautions. So this is just to raise awareness. 11% of the people from the Bame community that were sick were hospitalized with COVID, and 36% were admitted into critical care. The question I want to ask all of us is that, yes, we work in people-facing industry, and because of that, we are exposed to the virus, but does that explain the death? Why should that why should that increase the death rate? People can get the infection and not die so much from our community. So let me throw this question to Dr. Aino.
Good evening, everyone.
Good evening.
Well, as we've been told, my name is Tokpa Aino. Well, answering that question, it's not just like one factor. So there are few factors that will make someone who is exposed to have the infection. We know at the beginning of this pandemic, there were so many things that we didn't know. There were so many unknowns. People just went into it, and it was like a trial and error. So I'm not sure what the figure will be now.
Yes.
But I think most of the figures were from the initial time when, when the pandemic it just came. And so generally, when we talk of infection, especially infection that are contagious, that you can contact from people, that can be passed from people to people, from one person to another, usually there's the exposure, the more one is exposed to that infection, the likelihood it is that you will eventually come down with infection. So if we have people in our group that are doing that kind of work, that are they have contact with patients generally, then because they are exposed more, and that's what they do, I mean, that's their work of living, then there's every chance that that will happen. So that's one thing. The more generally, I mean, I'm not even talking about COVID. The more you are exposed to any disease, any infection, the more the likelihood, the more the chances that you will come down, that person will come down with the infection. And then, like I said, most of these data that we have, they mostly from the peak the other time, because we didn't know what was going on. So all the things needed to protect, I'm not sure they were not there. And if you are in a group that you are always in contact, and then you don't have the right equipment to protect yourself, then the likelihood is that that person will come down with the infection. So that's another thing that was happening that time. So for someone who is working in a situation, or in that kind of in a place where you meet patients, patients that are sick, the more contact you have, especially if that sickness, that disease is contagious, the more likelihood that you will get it. And then another thing is that, especially I know that at the peak, because those are this is one of the things that people have mentioned. People have mentioned that some of us, we don't talk out, we don't speak, even when we are asked to go and walk where there's no protective measures. We don't object. We find it difficult to object. We still go ahead and walk. And if that is happening, then the chances are that, we will be affected more. So those are few things that, that may make that that result in that kind of data that we have. I'm sure that the data might be a bit different now compared to the initial one. Okay, ma.
We can't hear you, ma.
Okay, can you hear me now?
Yeah. Yes.
Okay. So he's in social work, and from your experience, Joshua, can you tell us what do you think would probably expose the Bame community to being infected with COVID and leading to probably a hospitalization and death? Why do we come heavily impacted in that way, from your experience as a professional?
Thank you, Pastor. Just to build on what Dr. has outlined, my personal experience, not to even go into my work, I think it has to do with our perception of COVID. I don't think many people from our background, I think they have a different view of COVID-19. I think there were a lot of conspiracy theory that a lot of us we believe. And I think when most people were healed, I know people who are not going for tests. And I know people who obviously they self-isolated, but they didn't test to check what nature of their seriousness, or I mean, what is the nature of their sickness and the impact that may have on them. From obviously social work perspective, we from ethnic minority, we are more likely to not take it more serious, and we are more likely to obviously spiritualize it. And I remember when we were asked to close our doors as our local churches, some people obviously take a very offensive view of that. I need to mention this because I have to educate a number of people really about what that will mean for us if we don't actually follow what government is saying or is asking us to do. We are saving life here. And we are not operating at the same level of faith. Don't get me wrong, I know people who haven't got COVID, or they told me they haven't got COVID. And I know people who have got COVID. So there is this perception among us that initially, when it first started, that I'm not sure. I remember, I think sometime last year, my wife tested positive. I'm just going to cite this example and the impact that has on us, even as a church. And I called my ministers. I said that my wife tested positive. My wife works in a nursing home. She's a registered nurse. And we both work frontline. So in the midst of that intense infection, we were both going out to serve the communities and coming back home to our children. So obviously we were very high risk. So she tested positive at some point. And I called the ministers and said, we are going to have to self-isolate for 14 days at the time. And the way some of them were looking, it's like God has not answered our prayer. God has let us down. Oh, why? A lot of question mark. And I have to educate, I have to re-educate. It's not a death sentence. It's just that she tested positive. She's not unwell, she's well. But because that has happened, we are going to have to stay indoors. So there are a lot of stigmas as well from our perspective, from our community, if you do test positive. I remember after my wife tested positive, I have to go and do my test. I have to go to the center. The way people were looking at me, oh, Pastor, you are here as well. So fortunately, I tested negative. But I think the point I'm trying to bring out here is that the way we view it initially, there is this attitude that we didn't kind of take it serious as well. Apart from what Dr. Aina said about the fact that we work in the front line. Some of us are bus drivers. Some of us work as cleaners. In the office where I work, there are a lot of ethnic minority people, they're serving as cleaners. Some of us are nurses. Some of us we are security. So we are there serving people. We are the one that would take buses going to work. We are the one that use public service mainly. So we are more prone. And I think the attitude initially, obviously, makes some of us to be at risk. Some of the things that were propagated in the social media were not helpful. You know, at some point, I actually have to stop some of these things, address them in the church. Don't listen to it, you know, because the more you allude to those problems, the more you will not take this problem very serious. Let's despiritualize this COVID-19. Let's look at it from broader perspective. So I believe to some extent that our perception of it, apart from being in the front line, also contributed to it. We didn't take it very serious initially as such.
Okay, so now we are looking for solutions among the Bame communities. We know that we are better off if we work together to support ourselves and prevent serious illness and deaths among us. So let's see amongst us, let's see what Public Health England reports have about this COVID-19 infection. So what they are saying is that apart from the fact that we work in people-facing industries, but that once infected, the people, those of us from the Bame community, because of pre-existing health conditions, we are at increased risk because of the, I don't know whether it's gene or ethnicity. We suffer more from diabetes, obesity, socioeconomic status, poor area in terms of which expose people to high chronic diseases because of the condition of living, and that racial discrimination affect people as well. Racism have been pointed out. This is public health reports that when people from our group access medical care, maybe because we experience racism and then therefore that kind of like affects us, we don't pursue medical help as we should. So we hear that racism also affects our mental health and physical health as well. So there are many factors. We look at, so what are the situations? Like you said, stigma. Because of stigma, we don't want to seek for help. And then we are afraid of COVID because we didn't really know what it is. And so as a result, we would not, when it happens, people don't present early stage. And then lack of trust of the NHS services and healthcare treatment, resulting in reluctance to seek care on, for situations, and then it becomes late. And so all of these issues can lead to the reason why there are high deaths amongst our people. So tonight we are looking for solutions for those of us here. How do we prevent that? Now let's look at what the NHS England suggested, and then we'll come back to Dr. Aino, and then we take questions from our audience. So what they suggested is that strengthening a targeted program for chronic diseases prevention, which is something that we are doing now. We want to talk to ourselves, amongst ourselves. I was talking to another doctor that hosted the one for last month, that it will be good for doctors to come together, especially those of us from the African origin or from the ethnic minority, to educate ourselves about accessing medical help in this environment. There are many things we don't know and we take for granted. And so we don't assess the help that is there for us. So we need to educate ourselves. So she was telling me that you can ask for interpreter, you can ask for second opinion, you can do so many things. Doctor is on the line, he will tell us. So we are looking at how do we live well and better and avoid sicknesses and diseases in this culture. And so they are asking for culturally competent and targeted health promotion to prevent chronic diseases and multiple long-term illnesses. Targeting health checks programs for all of us here. There are different programs that can identify particular diseases on time so that they can be attended to. Talking about targeting obesity, improving common condition, including hypertension, cultural competence strategy for better symptom recognition, early diagnosis and early presentation to clinical services. So all of those things they said we can do. I don't know if we want to welcome Emmanuel Folari. He's also in the medical environment. Maybe he will be contributing to this discussion this evening. So Dr. Tokbe, what do you think we should do to help ourselves based on all this strategy that Public Health England has enumerated?
Well, I think the most important thing is to take our health very seriously and very important. Like my colleague, Pastor Joshua said, we tend to take things for too spiritual, and then if they say, oh, you have this thing in your body, the next thing most of all will say, I reject it. It's good to reject, but at the same time, you should go out. And someone once told me that when you want to pray to God, I'm even talking spiritually now, it's good to be specific. If you know what is wrong with you, you can tell God, this is what the report says, but I don't want it. But many times we don't even want to accept, because we feel that once we accept, then it is like we don't have faith. But it is not. Someone told, I was listening to one of these preachers in the US. He said that, sometimes, and even, miracles, sometimes it happens, immediately, but sometimes it's over time. It doesn't happen. You need something to keep alive until whatever miracle you are expecting comes to you. And another thing is that, people tend to believe that once you start doing something, then you don't have faith. But actually, even doctors know that they cannot cure anything. Most of these things we can't cure. We only take care. So at the end of the day, you still relying on God to cure you. But you need something to keep alive until then. So most of the time we think, like my colleagues, we take it too spiritual. We don't take it important. I don't know how many of us here know that once you are 40 years old, you need to be checking a yearly health check with your GP once you hit 40. Because many people, many young people, you hear them. I know we've heard, you just heard this one drop dead, that one drop dead, because they didn't know that they were supposed to be something that could have been prevented, very easily by taking medication, will become something that will kill that person, because we don't know that we shouldn't. We should do it. And sometimes when we even know, even myself inclusive, we don't take out time to deal with it. Most of us, we are like, oh, I have to work, I don't know, maybe because we are scared that if we go to GP today or tomorrow, then, at work, most of us, that's what we think more of our jobs than our health, where if you are given an appointment, are you keeping it? Do you go for the appointment? If you feel that, okay, this person is not listening to you, you can book an appointment with another doctor in your, so there are so many, it's not just one. So, but like Pastor said, many of us, we feel like, oh, we just have this mindset that they will not treat me well because I'm Black. Many people have that mindset. We should not. If you are not satisfied, you can check with other person, second opinion, like we said. They said, come, make sure you attend. Don't, even our children, many times, even to check their eyes, their teeth, go to the dentist, it's free. But how many of us do that? How many of us, take our children to access all these things? I don't know how many of us do that. And then problem will come, then we will start praying and doing gymnastics, something that we should have been avoided initially, but because we did not do what we're supposed to do. So at the end of the day, the most important thing that we need to take they have said it, they said we don't access, we don't do this. I think now we should start doing those things. It is for, at the end of the day, all this, if we, the other one they said that a stitch in time saves 9. Many of us, even if we look at, even in our community, in churches, many people don't share when they have problems. They keep it to themselves, and they are going through and they are struggling until the thing is now out of hands. That's when they will now start running helter-skelter. But when it was small, we're supposed to come out and just, yeah, please, because there are so many, in fact, sometimes things that you are thinking, oh, is impossible, maybe the next person beside you, have the solution to it. But we are, even though we live in community, but at the same time, we tend to be secretive to ourselves, carrying our own bodies. No, I don't want people to know what is happening with me, because of, again, stigma. But at the end of the day, if you have challenges, let them mock you. But at the end of the day, you've got this challenge solved. Which one do you want? To continue with the challenge, or it is solved. Once the challenge is solved, that's it. So I think we should be more, we need to learn to come out, to speak out and to access all these things. There's so many things, around us that we don't know. And if we know that there are some people, and there are so many people that have gone through the paths that we are going through, even in our community, but if we don't speak to them, we wouldn't know. We will struggle. Meanwhile, we shouldn't be struggling because we have people that have gone through it. They will just point us, this is what, signpost us, this is what you need to do, this is what you need to do. But because we are secretive to ourselves, no, I don't want people to know my problem, I don't want people to know my challenge, we go through that and we suffer in the end. Okay, ma'am.
Thank you very much. Thank you. I wonder if anybody online, my audience, would want to ask any questions. We've got Dr. Aino, Mr. Joshua Kende, and Folarin here also, who is also a medical personnel. If you have any question, you can ask. But before then, I remember speaking to one of the doctors, and she said to me that when issues like high blood pressure, diabetes, and many other underlying issues that do not have symptoms, because many of us don't go for early checkups, and as a result, when that individual comes in contact with COVID, it becomes fatal because, number one, they don't know that maybe their diabetic or sugar level is high, or they don't even know that they have a high blood pressure because then they are not managing it well and all of those things. So by the time they come in contact with COVID, it then becomes an issue it becomes life-threatening. So if we manage, like Doctor is saying, we believe God. I don't know who else is on the line now, in terms of, because we are Christians and it's a church that is organizing this program this evening. So you will hear us talking about God, faith, and the others. But we believe God for healing. But at the same time, while we are waiting to be healed, let's do all our checks. Somebody was talking about there's cervical head checks. There are all kinds of checks that are available when you get to a certain age. Let's not put those things away. Let's go for them. And then she was saying that if, for example, you experience racism in any of these journeys as you go, you can request not to see that person again, and that will be placed in your notes. And the next time you call for medical assistance, they will not lead you to that person. That there's so much rights that we have in this country. I wonder if Mr. Folarin, we want to say anything as to what do we do to help ourselves as a nurse practitioner yourself. What have you experienced? What do you think we should do to help ourselves?
Praise the Lord.
Okay, we are hallelujah, yes, but we are saying that, you know, it's open to everyone in the community. So there could be some people here who are not,
Okay.
they don't have our faith.
Yes, basically, I think the most important thing is for us to be properly and well informed, because information is the key to whatever, you know, we intend to do or intend to achieve. Like Pastor Joshua said, and then also, you know, Dr. Aino, if we are well informed, then we will be able to make an informed decision on whatever steps we want to take. I think information is the key. And then, like I always tell people, you know, I mean, information are so cheap these days, we can always see someone who can signpost us. And that's what most of, especially we, you know, of the, you know, Black minority don't normally do. You know, I mean, for one reason or the other, best known to us, but information is just all over the place out there. Whatever we do, if we ask, we'll always get, and the support is also there as well. I think that's all I think I can say. It's just about you know.
Okay, from your experience as a nurse practitioner, what other, apart from the information that is there about COVID is still out there, we know. What we are saying is that we don't even want to come in contact with it, you know, and then how can we prevent it? How can we ensure that we break that chain of infection? From your experience, what do you think may possibly expose somebody unnecessarily?
Basically, we need to follow the government guideline. It's very, very important. It's very, very key. I can guarantee you, if we follow the government's guideline and also the local policy, you know, I mean, whatever area we are, it will minimize our coming in contact with COVID. Yeah. I look after them every day, you know, so I know what it is. It's about just, you know, making sure, you know, we follow the protocol. You know, once we just adhere to that, definitely, you know, for us to come in contact will be very, very, you know, high. I mean, infection control is so prevalent these days, you know, I mean, proper hygiene is very, very important. It's very, very key. I mean, as little as it is, it minimizes the rate of infection. Cross-infection, cross-contamination, you know, I mean, even not just in the place of work, even at home, because charity begins at home. And then also, you know, I mean, I always tell people, I mean, I'll be shocked when I even see some people, you know, I mean, going to do a visit their friends, forgetting about cross-contamination. That's what they call cross-contamination. If governments say don't visit, they know what they say. And if they have to come and visit you, make sure, you know, it's in the open space. Not for you, but for, you know, even, I mean, your loved ones. And most importantly, I also advise people, if they have not, they should. I have taken my second, you know, I mean, vaccine jab. People should make sure they take, you know, their vaccine. It's very, very important, not for anything. These are part of the information I'm talking about. If you take, I mean, the fact that you've taken your vaccine, not that, you know, it's 100% guaranteed, but at least it gives you a level of protection, you know. So those are the things I think, you know, we need to look into to really encourage our people to, because people are still adamant about taking it. Even in you'll be shocked, even in the place of work. And most of the people are people from the Black minority.
Yes, I think you would agree with me that the issue of vaccine is personal. So what we are saying is that as long as we follow the government protocol, the reason for this discussion this evening is to prevent infection in the first place. And also to talk about other diseases that is prevalent in our communities, how we can prevent those things, how we can best use the NHS services for our own benefit. a large proportion of us, we are not on benefit, on social income. We contribute to the NHS and to the HMRC and the improvement of this community that we live in. And so we should assess the benefit that is in there for our health. So
Ma,
Dr.
with due respect, the number one benefit is to advise to take the vaccine. That's the number one benefit. If you're not taking the vaccine, you're only just shortchanging yourself. And I'm sorry, a time might come, they'll be asked to pay for this thing they're giving them for them free now. And they should regularly take the test. I mean, the tests are all over, it's free now. They should take the test to know their status. People should not be afraid to know their status. It is when you know your status, you can effectively pray if you want to pray. At least they say, protect yourself, take the vaccine, it's free. I have taken it, nothing happened to me. My family, everybody has taken it, nothing happened. The vaccine is safe.
Thank you, Pastor. What we said was that we were going to keep the vaccine at bay. On this discussion is the government protocol raising awareness, but that's fine that you have raised that. For example, yesterday I went for my own rapid test. It's very easy. It's better to know, and then it's free. And the result came within 30 minutes, it was negative. Having said that, I'm much more inclined to continue to promote awareness and adherence to the COVID protocol. Because if we adhere, then the issue of infection will be reduced and minimized. So yes, Dr. Aino.
I just want to add, yes, if you want to take, because I mean, even before this vaccine comes, I know there's so many people that have different opinion when it comes to vaccine and immunization. But one thing I know is that, and I think all of us know, before the advent of this COVID vaccine, what worked the first time last year was that we kept our distances, we washed our hands, and we used masks. Those three worked. Infection rate came down, last year. So I think even a few days ago, even our prime minister said it. He said, well, yes, you've taken vaccine. It is not like uhuru, everything is fine. You still need. He said it has been shown that keeping distance, using mask, everything did bring down the infection rate. It brought it down. So, and then like we all know, they've said it, even the vaccine doesn't mean that you will not get the infection at all.
Exactly.
It will only prevent you from getting to a stage where probably that person might die. So the most important thing, we all said it, prevention is better than cure. I mean, even the vaccine now, it is not like everybody is getting it at the same time. Even if you plan to get it, you need to stay alive to get it. And what will keep you alive so that you can get the vaccine is that you protect yourself by washing your hands, keeping your distances, and then by using your mask. They do work. I think that's what we must do. Whether we have the vaccine or not, we must do it.
Thank you very much. We appreciate you. Anybody online who wants to ask a question? I know there are other professionals online as well. You want to ask any question, please put your hands up so we can allow you to ask your question. I'm sure we are all interested in protecting ourselves, protecting our communities. We live in multiple households where we have multi-generational, sometimes large households for some of us, who have that kind of number. What I say to the people in my household is that when you come in, please wash your hands. Because as soon as I enter, I'm straight to the sink to wash my hands, put my mask away. And even if I'm out, as soon as I get into my car, I have a sanitizer in my car. The first thing I do is sanitize my hands before I even touch my keys and begin to drive. So, all of these things, we put these protections in place for ourselves, and then we believe God for his protection. We cannot say, I believe God or I've taken the vaccine, therefore I should go back to just living my life as if COVID is gone. COVID is not gone. We are still praying to God to remove it, but COVID is here. From what we are seeing, I'm not even sure. May the Almighty God have mercy on the earth and take COVID away. But a lot of people, I must say, it has now become a money-making machine for a lot of groups. Therefore, they can continue to well, this is my personal opinion. I'm not saying it's written anywhere, and I'm not saying anybody should take me for it. But my personal opinion is that it has become a money-making machine for many groups. And therefore, some people are more interested in keeping it alive than exterminating it. But in the meantime, we have to live in this environment and live in peace, not in fear. Just follow the protocols. So let's quickly look at the protocols. I'm still waiting. I haven't seen anybody's hand up. Can you leave a message on the chat box if you have any question? So keep your distance, follow the government protocol. If you meet 6 people outside your home or in your garden, stay 2 meters away from people, avoid crowd until the whole lockdown is lifted. We are still to follow the protocol. As far as I'm concerned, even come June, once they lift everything, I'm not going to be behaving as if there's no more COVID there. I will still be cautious because until we know what's happening, cover your mouth and do all the things, clean and disinfect. There was a time, including the light handle in my house, because I have a large family and they go all out, in and out, in and out. I use Dettol disinfectant to clean the door handles, clean everywhere. Okay. So Dickness, you can, unmute yourself and then please let us hear you.
Okay, good evening, everybody.
Good evening.
And thank you once again to all the panelists. I have been really enlightened. And I think this is the second one we're having. And I think by now, we should at least have maybe 3 or 4 go away with things that we will start doing now. I think they're about 18 or thereabouts on the chart. If you multiply 18 by 5, you're getting about 90. We can influence other people. But from last, I think, was it last week or 2 weeks ago, and today's discussion, I think my number one takeaway for me is, like Dr. Aino said, wash your hands, the government protocol, wear a mask, and social or self-distancing. So we should find a way of disseminating that in a language that the people of Bame, that make up Bame, would understand. Is it Punjabi, Hindu, I don't know, African language, Swahili? I think if
they do all the
yes, we should take it more, because that's what's coming. It seems we are repeating the same thing. We can't reinvent the wheel, but maybe break it down more, make it more colorful. Maybe there should be signages, because COVID-19 is a virus. When people talk about disinfectant, I just laugh. The main thing that can kill COVID-19 is soap, because it's a virus transmitted. It's transmitted, I think the doctors will say more than I about that. It's transmitted by respiration, and we carry it in our bodies, But if all these points they've said so far, we can find a way of disseminating it, maybe you have TV for Bame. I mean, you mentioned something about Bame doctors. Maybe let's see more of them on BBC, for example. Maybe have a program, saying, look, Bame needs to address this COVID-19 and 5 minutes kit or thereabouts. Well, I think we should go away with something, because we are saying the same thing over again, and the doctors are saying the same thing, which is wash your hands, wear your mask, and social distancing, and of course, access to NHS services, which is very, very key, and I agree with them. Thank you very much, everybody.
Okay, thank you. Adebimpe, please don't go. Let me just ask you. You mentioned certain things that you think we should do. because
Yes.
it's not only just COVID. We have a situation where there is a negative impact on Black people in terms of health generally.
Well, I would, if I can say that, because I mean, I have 2 kids and I had them here in the UK. And it's so important that we get information. There's information is all over, but do
Okay.
we access them? It's the same. Nobody hides information in this country, man. I
No,
know that.
okay. That's what
It's not hidden.
Emmanuel Folarin have said. The first thing he
Yes.
said was get information. So
Yes.
these are the things that we can begin to do now. So
Yes.
though it feels as if it's repetitive, but repetition and reminders are also very powerful.
Oh, definitely. We are
We
reinforcing.
said it last month,
Yes.
and today, as we remind ourselves, we say more. And then those of us who may have, maybe relaxed a bit, will pick it up again. And so
And
that is the part of government drive to remind and keep reminding and keep debating and keep talking within our communities. We have heard Folarin now, for example. Maybe what he has said, we encourage some of us to go and do what he has said. We have heard, if there are anybody online now who, for example, may not accept that, okay, if I have this, well, I won't want to call it disease, this medical health condition, and I go to the hospital, what should I then be doing? So what we have heard today that we didn't hear last week was that you should go and have the test, find out the result, take your medication, follow the principles while you are praying.
Yes, that's true.
And
I agree with that.
Another step that we have, we've talked about many things we can do to help.
Yes, so what I'm trying to say is
to see that we are always falling, they are saying Bame people are at the bottom. And then when you are talking about Bame people, you bring it down to the Black people.
Yes, okay. So even Black, look at the NHS, because it's, for me, like you said, information, and we keep on reinforcing it. I think until we start doing it, we have not heard it. That's something about communication. And I'm not against us saying this over and over again until everybody keys into it. It's like a butterfly effect. I hear it, I tell somebody else, who hears it, tells somebody else, and tells somebody else. Before we know it, everybody is doing it. So I agree that until the last person does it, we have not had it, and we should not stop doing this. But what I wanted to do was, like, how can we make it practical? Do we do leaflets? Do we go on, as for a TV program?
It's a medical issue.
Yes.
The NHS, we can approach the NHS to do leaflets.
Exactly.
But, do leaflets, because there are already hundreds and thousands of leaflets. Doctor, please tell us, you are the doctor. I worked in the NHS for many years. I can assure you, but we, the Black from the African background, we don't ask for things. People like Gujarati and all of that, they have hundreds and millions of leaflets for the various things that they do. But you don't find leaflets for Yoruba speaking, maybe Igbo speaking, because we don't ask for it. That's another thing we must take away from here.
So we should start asking. Yes, I think so. I think that's a key thing, that all the major ethnic languages, we should start asking for it. So it's also part of the policy that part of what, I think you can take to the, should I say other sponsors or whatever. Council is that we want to do it in Efik, we want to do it in Yoruba, we want to do it in Igbo. I think so. That's not bad. We want to do it in Swahili. I mean, at least let's try something new. I think it's worth saying,
because we normally will meet every week to discuss what the outcome for the community meetings. So what you are saying is that take back to them to say, okay, they should do leaflets in Yoruba.
Yes, in indigenous Black languages. Yes.
Okay.
If they do Yoruba, I'm so sure the Igbos will come up, the Hausas will come up. We are getting somewhere.
Okay, Doctor, talk, please.
What I just wanted to reiterate by giving us an example of what was, I'm not sure whether it was an experiment, but what actually happened. And it's just to reiterate and to emphasize the need for protecting ourselves, using gloves, washing our hands, and then distance, and then using mask. So I'm going to talk to us about two. So one that happened was that a person that was COVID positive traveled from one part of the world to another. I think it's about 8 hours or so flight. And the guy used mask and everyone used mask. And when they tested everybody, every other person in that flight did not turn positive, return negative test, because they all used their mask, including the person that was sick. And then another one that I read was that this man, or I'm not sure whether it's a man or woman, but worked in like barber shop. So, and did hair for 100+ people. That person was positive, used mask. All the people that came used mask. None of them tested positive. So just to show you that it can prevent. I'm not saying that that's what is right to do. If you are positive, you go about doing that. But what I'm just trying to say is that we can protect ourselves. I mean, compared, and I have, just to talk about, another thing, one of the reasons why most of us get this thing is because we live amongst ourselves. And then, so if you are a young person, most of the time it will not affect us. But a young person who returned positive test and still was staying at home with his parents. You can imagine what kind of aged parents, not even telling them, not even taking, that is not a good thing to do. You see, you must, once you are, that's another thing we must do. Once you test positive, you cannot continue to stay amongst people just like, nothing has happened, because you are putting those people at risk. It doesn't matter whether you are a young person or not. You need to know that you have to separate yourself. There's nothing like, oh, we are family here. There's nothing like that. Yeah. That's some of the things that happen, and that's one of the things that can also cause this problem of increased death.
Okay, thank you very much. Let me see. Before I take Folari, it's Joshua. Mr. Joshua, please, can you enumerate on what we have heard so far? We want to take something home. I've written down, let's get informed, let's get tested, let's take our medication, and if it's not working, we can go for reviews, we can do so many things, and then we'll pray. So we are asking to do leaflets in our local dialects. Then we have heard over and over and over again, please follow the protocols and then break the chain of infection. These are like 6 steps that we should take away from here. Yes, Joshua.
I will just add to it. I will say that we should be open with our employers about our health issues. Some people have health issues that their employers don't even know. And if the employer don't know, they put them on the front line. They requested, obviously, for them to do shift that put them at risk. But however, if our employers have an understanding that somebody among the employees is HIV positive, they need to be protected. Somebody among the employee obviously has underlying respiratory issues. Somebody among the employee has this underlying conditions that will impact on their well-being if they have, or if they tested positive for COVID-19. I think they might put in a risk assessment that will obviously help to prevent them. I know employees since the beginning of the COVID who haven't worked at all on the front line. And that was because the employer knows that they have health issues. They've been working from home for almost a year now. I know employees who have not gone out to visit families, because if they do so, that might put them at risk. And this employee is also from ethnic minority. So, and that is because they were open with the employer. I have this health issue, and this is what the government guideline is saying. And the employer obviously is they have the duty to put in place a risk assessment. So let's be open. Let's be open. Let's not obviously withhold information about our health issue. I will also say to people, please assess your employer support. Employer now have obligations. It's now mandatory that we put support in place for any employee that come forward with any underlying health issues. In my place of work, I think employees have to do weekly, they have to do weekly tests at least twice. So that flu lateral test is there. We have to assess it. And we spoke about vaccination. Employers are now encouraging the employees to consider vaccination. It's not yet mandatory yet, but you will hear that the government is considering making vaccination mandatory for people who work in nursing home. And that was because nursing home have higher mortality rate when the COVID first break out. And some of the issues have to do with employers who are coming in and out, and therefore bringing COVID-19 into the residential. So we need to understand that we need to assess employer support. We need to, things are far more better now than what it was when this disease first came out. So we need to assess. When we are open, then the employer will put something in place, and then we must cooperate with our employer to ensure that we have access to whatever support that they put in place. And I also say to my colleagues and to my work people, follow your employer risk assessment. Most of us, we don't do that. So we tend to do our own thing. We tend to, yes, it's good to believe. Yes, it's good to have faith, but let's also follow whatever safeguarding measure that is in place. And that is how even God answers our prayer. God answers prayer in obedience. And that is the reality. So let's follow employer risk assessment. And what we are doing at the moment is good. We are campaigning on the issue. We are having this discussion among ourselves about how we can prevent. This is a preventative measure, actually, to synthesize ourselves, to open our eyes onto what we need to do, so that we don't get drawn up. People have died for little reasons. And when I hear people died, it makes me sad. And why do they die? Because they were not open, because they did not access, support measure on time. And also we need to despiritualize. We must despiritualize this matter, this issue of COVID-19. Yes, there are spiritual issues behind it. But aside that, let's take further steps to also demystify it. That is what we are doing right now. And I believe it will go far in ensuring that things work better for us. That's my contribution.
Thank you very much. Folarin, please. I see your hands up.
Yeah, yes, ma'am. Basically, I think Dr. Aino and Pastor Joshua have actually, kind of said it all. They've nailed it. I just want to kind of appreciate you more, ma'am, because what you are doing, like what Kenny said, is like, we're actually just sensitizing our people. You cannot overemphasize what you've said. And the more we keep re-echoing it, the more we keep drawing bell. And just to add on to what Pastor Kenny said, basically, the information about our health issues to our employer is very, very important. It's also another key. And most of us, I will say it, I used to be guilty of it myself until I realized the importance of it. We need to look into the policy of our organization. It's all embedded in there. There are so many benefits in there, and also there's also room for confidentiality. So if your health issue and all is not something that you're going to be in the public, but you need to express it to them. Once you tell them, they will do what is needful to be done. And the other lady that talked about, we going back to our local bureau, yes, the opportunity are there. They can translate in whatever language. Even the government is doing everything possible to push the message out there. So what you are doing is very, very, how do you call it? I would say it's advantageous and it's very, very informative, man. I will tell you not to stop it, keep doing it. And the more we keep doing it, the more we keep reminding ourselves. Each time we do remind ourselves, and there's always something to take over to our people. And most important and lastly, we should also lead by example, practically. I know I've actually convinced so many Black minority of my colleagues in taking the vaccine, and they have taken it, and they saw the benefit. Because people were so adamant about it, but I told them about my own personal story and why we need to take it. And then, leading by example, also, I think it's another thing we might even take away from here. Let us say that we're actually doing what we are saying by practicalizing it. And I think by so doing, God will help us. Thank you very much, man. Really appreciate it for this platform. Thank you.
Thank you, Folari. Thank you. We really appreciate you. We have 5 minutes. Okay, we started a bit 6 minutes late. Thank you so much for everyone who contributed. Is there anybody question anything? It doesn't necessarily mean it has anything to do with COVID. There's a doctor here. There are all nurse practitioners here, medical people here. You have any question you want to ask? What we are saying is that enough is enough. What I'm hearing is let's talk about it. Let's be open, so that we can assess the health, the help that is available. We shouldn't just let things slide. Sometimes we think, oh, I don't want to trouble people. I went the other way. They were not so nice. I'm not going to go again. By doing that, we are not doing ourselves any favor. If you go somewhere and it doesn't, it's not favorable to you, ask to go somewhere else. Ask and ask again. It's your body, it's your health, it's your life. If you are taking any medication and it doesn't work well with you, go back and change it. If that one doesn't work, go back again and change it. Keep going, because that's you are a taxpayer. You are entitled to care. So let's not be too no, I don't want to disturb them. I went the other day. Oh, that's how they didn't attend to me. Go and go and go again and again and again and again.
Can I say something, please?
Yes. Okay. Thank you, sir.
Yeah. Let me salute all our panelists and I thank you for all the contributions you have had. What I just want to say is this issue of maybe our own background. I think there are sometimes it will appear as if we are putting so much importance to making money, even if it's risky. I know that we all have need for money, but when it comes to our health matters, like somebody advised that people should disclose their health issues, because we should not just say because I must just get this money, even if it's risky. So I think that's another area we need to look at, because we should know that it is while we are alive and well, we can even spend the money. Thank you.
Thank you very much, sir. That is very true. Somebody, they said there's COVID, or you are not well, or you have underlying health issues. You are going in an environment over and over beyond your allocated time because you are looking for double money. Now, the one who is dead is not going to spend money. Again, we should understand that. Okay, thank you. Bigbe, I see your hands. Just 1 second. Is it only Bigbe that is on this platform? The rest of you are not talking, apart from the panelists. We want to appreciate all of you for coming. We really do. We really want to appreciate all of you. But it would be nice if we hear, before we take Bigbe's question, if we hear again from other people. Okay, Shola, I can see your hands. Bigbe, we'll come back to you in a minute, because let's just, Shola, please.
Yes, I was just going to add that, just to buttress what the other panelists have spoken about regarding assessing what you have at your places. There are so many organizations that have occupational health information. So even if you don't want to speak to people, these are confidential, like phone lines that you can talk to specialists about. So it's available in most of the workplaces. So it's always good to ask your HR department that you want to speak to those occupational health therapists, and they will help you with whatever challenge you have in terms of health. And they also have other facilities apart from health instructions, even on wealth, anything like pension, anything that is worrying you. So it's good to access those facilities at our workplaces.
Okay, thank you very much. Before we close, what about the issue of racism? What are we going to do about it? We know that there is, the reports have been out over again and again and again, and we hear it every day on the news. What action should we take to overcome the issue of medical racism? Well, let me ask, Big, I see your hand, but let me ask, we'll soon close another 1 minute, 2 minutes. Would you say, because I experienced racism, then what should I do? How should I overcome that? Tokwe, you are muted.
Well, I would say don't give up. That's all I can say. We all know that is there. Um, and also, apart from that, there are also channels that we can, if we experience it, there are channels that we can go, we can access, we can, report it. And then, but I think as outside that, because when one experiences that kind of thing, there is that possibility for us to become depressed and dejected and just give up. But I would say don't give up. You can, if you are worried about it, there are routes that you can go through to report it. But in yourself, don't give up. Just keep going. That's all I'll say.
Okay, thank you very much. Yes, Adebimpe.
Sorry, I'm just going to, based on what a previous speaker had said about the fact that people still go to work though they are ill. So I'm just wondering if we can also signpost them to where they can get financial aid from, because they may not know that they're entitled to, X amount like we had earlier, and they still go to work and they're sick. So if there's a case where we can tell them this is where you can go and get help from if you don't go to work, and then I think that would help, if we can add it to the, part of the information we need to disseminate, man.
Okay, where they can get financial aid.
They are not working. Because
this,
why do they go to work? Because they don't have, and they are ill.
No, some people, not because they don't have money, they need extra over and above. So, which is part of the problem. It's not because what they have is not enough, but because they want much, much more. They don't know when to stop. Like our white counterparts, the Caucasians will not do that. They will work their shift and then that's it. They go on holiday, they take time out. But
so that's part of it. Encourage them to go on holidays, to take a break. You can't work for too long. You shouldn't,
we should. So that's what we are doing here now. We are encouraging ourselves. Yes. Take a break.
Yes.
Go on holiday. Don't work for too long. This is part of the health preventative measures that we are talking about. So again, there are many information on. We are, what is it called? Helping ourselves to help ourselves.
Yes, ma'am. Thank you.
Okay. Thank you very much. Yes, thank you. I think if there be no more question. Okay, Pastor Joseph, were you saying something? Can you unmute yourself? We can't hear you. You are muted.
Hello?
Yes.
Yeah, I'm saying that just like you were saying towards the end of something, we are doing this for ourselves. And I think that we are the ones who should be at the vanguard of disseminating the information to other people. But like somebody said before, which is really very crucial, we are living to, a privatized kind of life. We don't want to disclose things here and there, which is not helpful to us. There are so many things we can pick in the community that can help us, but because we don't talk. So I think when it comes to issues like this, we should be open. And I think we are seeing it among ourselves now. So we should go from here and add it to whatever we want to share, even coming out from this meeting. Thank you.
Thank you. Can I say that we are not a group. It's just one person, a church that is putting this thing together. Can we all work together like the Asians do? Now we have heard. So in all our environments and the people that we have access to, we can begin to encourage them and share this. So there's no particular thing that I as an individual now will say I do. I'm going to take it on board to, spread it all around. Those of us who have come now, we are here. Let's continue to encourage all our people that we should keep to the COVID protocols. And then for the young people, I was talking to the young people, especially the teenagers and the young adults and in our environment, because they know that it doesn't affect them. Some of us, we have a wrong attitude towards it. But don't forget that we have adults either in our homes or in our environment that we contact. So those of us who have children of those young adults, we should encourage them to be careful, not to be so laid back. Because I'm a young person, it's not going to harm me. Therefore, I won't put systems in place. we should, and you know, we shouldn't have that kind of mind. We should have the mind that I'm protecting the people in my environment, so I must put all my systems in place as I'm dealing with people, so that we don't keep, we want to break the chain of this infection. So all of us as families, we talk to our children, talk to ourselves, and keep the COVID protocol. Thank you all very much. Thank you, thank you, thank you. So let's just recap. Today, we agree that the informations are out there. We should go get information. We agree that we should go get tested. We agree that if we have any health issues, we should go out and see our GP, take our medication, change the medication. If you're not happy with it, add prayers to that. It will help you. Those are the action points we should take home. We agree that we should maybe contact the council, and you can contact the council in your various environment to put these things in maybe Yoruba, Igbo, Hausa for now. That can happen because all the others have their languages there. We agree that we should all continue to follow the protocol and encourage people in our environment. We agree that we should be open to our employers and tell our employers what the situation is. If somebody is unwell, he has maybe underlying issue, have the diabetes and all of that, whatever it is, and you are frontline, tell them, let them know, they put systems in place, and then follow the employer's risk assessment, and then demystify COVID, and then overcome racism whenever you encounter it, keep pressing on. I think we have 9 solid or 11 solid points that we have taken out of this meeting today. Thank you very much. I want to then ask, because we are Christians, we believe God is the one working. Can I ask that Pastor Joseph pray for us as we go? Thank you very much. We are 10 minutes late, but thank you for your question.
Our Lord and our God, we are grateful to you for what you've done for us tonight. We thank you because we know that, Lord, before you gathered us here, you knew what exactly we were going to achieve. And we thank you, Lord, for the grace. We thank you, Lord, for the panelists. We thank you, Lord, for the church. We thank you, Lord, for all those who have participated. We are asking that, Lord, in all of these things, let your name be glorified. All the help we are desiring, Father, please help us so that at the end of the day, we shall have every cause to rejoice and praise your name. Thank you, Almighty God, for in Jesus' mighty name we have prayed.
Amen.